Hey there, do you have a back problem and do you think that it's coming from a muscle imbalance in your lower back? Well, I'm going to talk to you today all about muscle imbalances, where they begin, how they affect back problems, and what you can begin to do about it so that the root problem, which is usually a muscle imbalance, is taken care of and you can live a happier, healthy, more active and mobile life. Real quick, my name is Dr. David Midoff and I'm a manual physical therapist over at Paso Manual Physical Therapy. I've been helping out people with back problems for many years, and just about every single one of them has a muscle imbalance at the root of their back problem. Now, when they go to the doctor, when they go see their healthcare professional, they gave them a diagnosis for their back problem. They're usually told that they have arthritis, a disc issue, sciatica, stenosis, other back conditions like that. Spondylosis is another one, degenerative disc disease. There's tons of back diagnoses that are given to patients, especially after they get like an MRI or an X-ray. But those diagnoses don't tell people what to do about it. They just kind of give it a label, but don't really tell them why it became, how it got there. And what we find here as specialists in helping people avoid surgery, medications, and injections is that usually the root of a back pain problem is a muscle imbalance. And what a muscle imbalance is, if we look at the spine here, the lower back, here's the lower back, here's your lumbar vertebrae, the lower back. There's muscles all around here. Of course, organs are in the front of the body here, but the muscles that control and move the spine, you have the muscles that go up and down the back. We call those the spinal, the paraspinal muscles or erector muscles is in the name. There's lots of different names, but they're the ones that run up and down the sides of the spine on the back. Then in the front, we've got the abdominal muscles, which connect to the rims of these bones, the rim of the ribs, and then they do send tendons all the way down to the spine. And then you've got hip flexor muscles, which are on the front and they help to bend your hip this way or flex your hip, but they do have some attachments up into the lower back. Because all of those muscles can influence the movement and control and stability of the lower back, you have to have a proper balance between all those muscles so that movement in the lower back is normal. When one of those muscle groups or two of those muscle groups becomes a lot stronger or a lot weaker relative to the other muscles that stabilize the back, then that's what's called a muscle imbalance. It's out of balance. And what's going to happen as a result of that is every movement, virtually every movement that that person goes through, that you may be going through right now, walking, getting up out of bed, standing, doing chores around the house, being active, like doing exercise or participating in sports, playing with your family, working, all those things are done with an imbalance. So over time, joints can start to get affected, discs can start to get affected in the spine, nerves can start to get pinched, different little things can happen, and it's a chain reaction of events that's set up because of that muscle imbalance. And most people will, admittedly, whenever we see them here in the clinic for a back problem, they'll say, oh yeah, I've got weak abs. You might be thinking that at home already. Or yeah, I've got weak hip flexors, or I've got tight back muscles, which is a sign that they're over dominant. They'll say things like that that expose a muscle imbalance. And a lot of times even healthcare professionals have a hard time finding this out because they're just not trained in it. Especially if you've been to a physical therapist. I'm a physical therapist, so I know all about that field. Most physical therapists are excellent at handling cases of patients that have just had surgery, which means, they just had a back surgery, like a fusion surgery or a discectomy or a hip or knee surgery or surgery elsewhere in the body. Most PTs, just about every single one of them, know how to handle that kind of situation very well. But handling muscle imbalances is a different specialty, which is something that we do very excellently. And identifying it, then knowing how to train it, and knowing what exercises to do, what exercises not to do is a big deal. Let me just be specific. If the most common back muscle imbalance that we see here are the muscles along the back, the ones that you can just reach over to your back and feel, are over dominant. So most people feel tight in those muscles. If that's the case, then it makes sense to avoid doing back muscle exercises. Avoid strengthening your back. One of the classic exercises that is done in a physical therapy clinic is back extensions, or even in gyms where they'll lie on their stomach and then they'll lean this way to tighten up these back muscles. And the thought is that if you strengthen those muscles, it'll take the back pain away because we have a weak back. But in reality, if you approach it from the angle of there's an imbalance and these muscles are dominant, then we don't want to strengthen these anymore. We actually want to strengthen the other muscle groups so that there's a balance. And that's how we take care of a problem for the long term, because it is possible to get short-term relief by strengthening the back muscles, even though they're already strong and dominant, but it's not going to solve the long-term problem. In fact, it's going to feed into the root problem, which is that imbalance. So you got to watch out if you're getting treatment right now, or if you're looking for exercises and videos on how to fix a back problem and you're thinking you have a weak back. You got to think twice about that and really look at your abdominal strength, kind of test it out. You might do different motions, different exercises, do some sit-ups, do some ab exercises, and see if you tire out quite a bit like that. And if it's done right, it should begin to resolve the muscle imbalance, which will resolve the root problem of that arthritis, the disc issue, the pinched nerve, all those symptoms that are, or not symptoms, all those diagnoses that are found by mainstream healthcare. What's going on when there's a muscle imbalance is if the muscles, let's just use that example, that the muscles on the back of the spine are too short, then what will happen is if they're too strong, they shorten. When they shorten, they compress the joints on the back of the spine, they compress the discs. And if on a low level, they're held like that all day long as you go about your day and do your normal things, you get wear and tear going through the back of those joints. And it's just a matter of time before something gives. It could be the cartilage, it could be a disc, it could be a variety of things. And that's typically what leads people to go to the doctor to go get x-rays or an MRI. And then they tell them, oh, you've got a pinched nerve, or you've got a compressed disc, or a slip disc, or a herniated disc, or you've got arthritis. It's rarely ever the arthritis's fault. It's the muscle imbalance's fault that led to the arthritis, or to the disc, or to the nerve, or whatever the problem was. And so addressing that root problem is huge. It's key. Another issue that these muscle imbalances lead to is sacral problems. So the sacrum is this bone down here. It's the base of the spine. A lot of times we get people that come back from the doctor's office. They've had an x-ray, they've had an MRI, and they've been told that everything's normal. Maybe some mild changes that are kind of normal for the age of that person. Nothing of concern, definitely nothing that can be operated on. And it's confounding. It's so confusing for the individual because they think, I can't sleep at night, my back hurts. I bend over, and after doing that so many times, I'm done for the day. I'm paying for it the next day, in fact. But the doctor isn't finding anything. The surgeon doesn't want to touch me because they think that I'm normal on my x-rays and MRI. There's nothing to operate on. Why the heck do I still have this back problem? And a lot of times it's because this sacrum, the tailbone, is shifted, or the joints around it are stuck somehow. And that doesn't typically show up on an x-ray or an MRI, but it's also a side effect of that muscle imbalance, the same one that I'm talking about, where muscles around here are too weak on one side, too strong on the other side, and it can yank the tailbone or these pelvis bones in different directions as well. That can produce back pain. If you're having that situation where your back isn't really affected according to x-rays or MRIs, but you have pain, that means that you've caught it early, and fixing the muscle imbalance is going to be a tremendous thing for you to do so that you can avoid it turning into an arthritis or a disc problem or some other worse condition that might have some more longer lasting effects. If you want to learn how to test your muscles to see if you've got a muscle imbalance in your lower back and begin to understand which muscles you need to work out, which ones you need to avoid working out, check out our upcoming video on testing those muscles on yourself so that you can begin to figure out what's going on in your back problem and address the root of the problem. I hope that this video was helpful for you. Please, if you want to get that video, please hit the subscribe button right here. Hit the notification bell as well so that you can get notified as soon as that video comes out. And of course, you'll get notified whenever we release other helpful videos that allow you to avoid surgery, injections, and medications and get back to being healthy, active, and mobile. I hope you liked this video. Give it a like if you did, guys. Have a wonderful day. Bye-bye.